team. We want to welcome you to today's Lunch and Learn. Today's topic is youth suicide prevention and mental health services, and it's an incredibly important one. By being here, you're helping create a space of hope, understanding, and connection. And our amazing speakers will guide us through valuable information that strengthens our ability to support young people, reminds us that none of us are alone in this work. So without further ado, some things to take care of before we pass this off to our speakers. Just a couple reminders for today's session to please remain muted throughout the presentations. Q&A will be held at the very end, but please feel free to use the chat box at any point. And the webinar is recorded, so it will be accessible afterwards. And thank you once again for joining us for this meaningful and empowering conversation. Without further ado, we'll hand it off to our first speaker to introduce themselves.
Good afternoon, everyone. My name is Cassidy Todd. I'm a clinical supervisor with Tarzana Treatment Centers.
Hi, everyone. Thanks for being here. I'm Cheryl Eskin. I'm Senior Director of Teen Line, which is a program of Dee Dee Hirsch.
Good morning, everybody. My name is William Ortega. I am with the Office of Violence Prevention, and I am one of two LA County Gun Violence Restraining Order Service Navigators.
Good morning, everyone. It's a pleasure to be here with you this morning, or afternoon, rather. My name is Ana Leiva. I am a Senior Health Analyst with the Office of Violence Prevention. And I get the pleasure of starting us off. I will be joining William this afternoon, and we will be sharing about our work that we do with regards to gun violence and our youth suicide prevention efforts. Before we get started, I would like to get us grounded with acknowledging that today's presentation, our portion will include reference to gun violence, and suicide. We understand that this can be difficult and emotional charged topics. These issues affect all of us in different ways, not only professionally, but also on a personal level. Everyone comes to this conversation with their own experiences, and we honor that. We invite you to take care of yourself throughout this session, and if you need to take a moment to step away, turn off your camera, please do so. We encourage that you find your way to support yourself and ground yourself as we continue to discuss today's topic. And as we mentioned, William and I are both members of the LA County Office of Violence Prevention. The Los Angeles County Office of Violence Prevention was established in 2019 to unite county departments and community partners around shared vision for a violence-free LA County. And our goal is to strengthen collaboration, capacity, and foster partnerships that prevent multiple forms of violence and promote healing across all communities. I'm here today to share with you about some work that was birthed in 2023. Our Office of Violence Prevention put together a response to funding that came from the California Department of Public Health between June of 23 and June 2025. We put in place a youth suicide prevention pilot that aimed to quickly identify and respond suicide and suicide attempts among individuals under the age of 25. It focused on three main components listed here. One is exploring opportunities to rapidly report data on suicide deaths and attempts, develop crisis response strategies that can provide support to families after a youth suicide attempt or death, and increase general knowledge on how we can all work together to prevent suicide in our communities. And what I like to do first is just provide some highlights of what happened during those 2 years of our pilot program. This here highlights some of the work that we initiated. For example, we established, and I do want to say that our efforts spanned over different systems. For example, we established a memorandum of understanding with the Department of Health Services to put in place care coordination by medical case workers in hospital setting, and I'll be sharing a little bit more in a bit. And we also enhance the referrals using the One Degree platform and develop the Youth Suicide Prevention Network of Care. We also established an MOU with the Department of Parks and Recreation, where we trained individuals, staff individuals. We contracted with community-based organizations to expand or put in place support groups in highly impacted communities, which are our Service Planning Area 1 and 2 in LA County. We also funded a short-term local media campaign. Today, you may still see some of our billboards or some of our ads in bus stops. And that work actually took from the Never a Bother campaign that the state put in place during the pilot time as well. And we made it our own by providing, enhancing the messaging through the collaboration with some of our partners that provided input, as well as youth in different leadership groups. We coordinated with the Department of Health Services, with the Department of Public Health School Wellbeing Centers. They currently run 48 centers in different school districts. We also put in place the distribution of the Never Bother campaign material that the state was running at a state level. We identify CVOs to distribute those materials, and we actually continue to do some of the work. Some of this work, continues on. And we also work collectively with the Department of Health Services and other partners to put in place training and education events. Now I want to dive a little more deeper into the work that we have done with regards to youth suicide prevention crisis response with DHS. As mentioned earlier, we established an MOU that gave birth to a care coordination service in 2 out of the 3 focus hospitals, which is Harvard, UCLA, and Olive View. Through that work, we provided post-discharge support to youth and families after an emergency department visit. And I do have to say that this was a very short-run program because it took some time before we were able to establish the work that we were doing at those facilities. In a matter of span time of about 3 months, we received 71 referrals from the psychiatric units and medical social work units. We served 33 youth, and youth were served for a span of 2 months minimum. We also enhanced the One Degree referral system, which we're really excited. Many of you have probably already learned that we have a current system within One Degree that collects resources aimed to provide resources and tangible referrals for mental health and youth suicide prevention and postvention as well. During the pilot, we were able to, and this number has increased. I'm just sharing what we were able to accomplish within a very short period of time. 65 community-based organizations were added to the collection of youth suicide prevention resources. At that time, by the end of June, we had 35 organizations that joined. And I also want to mention that this funding allowed the allocation of 30 licenses for CVOs and organizations to join the closed loop referral network that exists within One Degree. And we're really excited about that. Currently, as I mentioned, the pilot gave birth to some of our efforts, and we have been really fortunate to continue on some of the work that we started. Through new funding from the Probation Department, through the Juvenile Justice Crime Prevention Act, the JJCPA, we have been able to put in place. And by the way, that is a systems involved youth effort. However, it allows us the opportunity to expand resources to other youth in our communities. We continue to provide that grief support groups in service planning area 1 and 2 that I mentioned earlier. We were able to rapidly reestablish those contracts so that there was no interruption in services. We provide ongoing capacity building, mental health, and suicide prevention trainings for OVP partners. Our focus is to expand the awareness within our own CVO partners, but also we are working with other community partners and faith-based communities, as well as county partners that may not have access to some of the trainings that we're doing if they weren't involved with us. Some of the suicide prevention training, gatekeeper trainings are with a special considerations in mind. We are making sure that we are adapting those trainings to meet the populations that these CVOs are serving. And we are putting together a youth mental health first aid certification training in the month of December. We received quite a lot of interest for that training. And at the moment, we have 35 community partners and other county partners in register for that training. Our goal is to offer more youth mental health first aid certification trainings. And if any of you here are interested, I would invite you to please reach out to me, and you'll have our contact information at the end. We are also putting together a building community through care and connection, train the trainer. That's happening in January of next year. And also we have limited slots, but if anyone here would like to learn more about what that work entails, please feel free to reach out. We continue the Never Bother campaign materials and marketing prevention materials have been well received by community, and we have decided to continue with that distribution. We are in the process of buying a high printing amount of these materials, and we'll continue to share them out in events and also give CVOs and partners an opportunity to reach out if they would like some of this material at their agencies. What are our futures to continue some of the work? You know, we work really hard during the pilot era to really identify gaps in services in areas that needed more attention. And we want to continue to fund, for example, the post-discharge care coordination program that I mentioned with DHS. And I'm happy to share that we have come together. We have identified funding that will continue to allow us to put this back in place. At the moment, we are looking at reinstating the program at Olive View and Harvard UCLA. We have already hired a program manager that will help us bring on board medical case workers that meet the need for this type of work. And we are hoping that LA General Hospital will join us in the near future. They were not part of this initiative in the past, and currently they don't have the bandwidth, but we continue to have conversations with them so that they can also join, and we can also serve the community patient, the patient community of the LA General area. And as I mentioned, we continue to look for sustainable funding for some of this work so that we can continue doing this past June of 2026. And this is a link to where you can find some of the resources for the Never Bother campaign. I mentioned earlier that we are buying bulk printing materials, but you can also go to the website, the Never Bother campaign website, and download some of the toolkit that they have made available for LA County. This is my contact information. And again, I think we're holding questions until the end, but you are welcome to also reach out to me if you have questions. Thank you, everyone, for your attention. And I will pass it over to William.
Thank you, Anna. Good afternoon, everybody. As indicated earlier, my name is William Ortega. I am with the Office of Violence Prevention. I am one of two GVRO system navigators. My other colleague, Daniel Fong, is the other systems navigator. If we're going to be presenting today on gun violence training orders, which is a little known tool to help deter firearm violence and suicide prevention. In 2024, the U.S. Surgeon General indicated that firearm violence in the U.S. is a public health crisis, with over 48,000 firearm fatalities in 2022. More than half of those were suicide. In California, in the United States, there are only 21 states that do have an extreme risk laws. They're also known as red flag laws. In California, they are known as gun violence restraining orders. A little background about our office and the gun violence restraining order. They were passed into law by the California legislature in 2014. They became effective in 2016. The LA County Gun Violence Prevention Platform was introduced in 2023. And currently, we are conducting GVRO outreach, which includes tabling, workshops, trainings, and educating our community members, stakeholders, and county partners on gun violence restraining orders. Gun violence restraining order is one of 9 restraining orders that are known. We specifically, the main difference between the GVRO and, let's say, another type of restraining order is that it does not require the individual to have no contact with the petitioner or with the petitioner's family members. The GVRO specifically prohibits an individual from having access to firearms, ammunition, or magazines, or from buying or receiving gun, ammunition, or magazines. It requires the individual to go ahead and turn in, store their ammunition or magazines to law enforcement, or to sell them or store them to a FFL, which is a federal firearm license dealer. There are certain individuals who can file for a GVRO, including the ones that are closest to the individual in question and may see the warning signs first. They include family members or loved ones related by blood, marriage, or adoption, a current or recent household member or roommate, a coworker who has had regular interactions for at least 1 year with the approval of the employer, an individual who has a child in common or a dating relationship with a person in crisis, law enforcement, a teacher or employee at a middle school, high school, college, or university where the individual has at least 6 months with approval from the school administrator. There are 5 basic steps to request a GVRO. The first one is to fill out the GVRO application. Second step is to file the application with the court, and you can go ahead and either complete the application at lacourt.org/courthouse or at any of the family law courthouses in LA County. Third step is once you have submitted the application with the court, you will receive the application back from the court with a tentative court date. The fourth step is once you receive that court date back, it is your responsibility to serve the individual who you are filing a GVRO against. So just for clarification purposes, you are requesting the GVRO, so you are known as a petitioner, and the person who you are requesting the GVRO against is known as the respondent. The fifth step is both the respondent and the petitioner will come together at that pre-scheduled court date to provide substantiating evidence for the judge to make the final decision of whether or not to grant or deny the GVRO. As I indicated earlier, I am one of 2 of the GVRO system navigators. We provide education, guidance, and support on how to obtain a GVRO. This includes hand-holding individuals through the legal process. What I mean by that is a lot of our community members do not understand the legal jargon, nor do they understand the judicial responsibilities once they file a legal document. So what Daniel and I will do is we will literally hand-hold them through the process, explaining to them the judicial responsibilities, as well as ensuring that they understand the judicial language. This can include us going and advocating for them at the actual court hearing date. We are available 8 to 4:30 p.m. I encourage you to please reach out to us with any questions or concerns that you may have. These are our direct county cell phone numbers. You can also go ahead and shoot us an email at ovp_GVRO@ph.lacounty.gov or ovp_gunsafety@ph.lacounty.gov. And you can always visit our website at lacountygvro.org as well. Part of our gun violence prevention platform is also the free gun lock safety gun lock distribution, excuse me. And what we do is we are able to go ahead and provide free gun locks for our community members. They can access access the gun locks at any of our 6 medical centers and our tool lending libraries. Most of these libraries and medical centers do have at least 2 stands where the individual community can go ahead and grab gun locks. In addition to that, you can also, or they can also email us at lacountygunsafety.org, and we will mail them up to 2 free gun locks, no question asked. We invite you to please stay informed and connected. Visit our website. I believe that it is in the chat. And we offer a plethora of resources, including a monthly newsletter. And we also have a lot of data. We do encourage you to please reach out with any data requests or any available data that you may need for your program. We do also offer other program suicide prevention, trauma-informed care, education, and other resources, including school-based violence, hospital-based violence, gender-based violence. So we have a plethora of other supportive resources available. In addition to that, you can request gun violence prevention materials or support. And what we do is we go ahead and we provide workshops and trainings to either law enforcement or any one of your programs where you feel that this presentation would be of benefit. Please scan the QR code and it will throw you to our webpage. As I indicated before, Daniel Fong and myself, we are the system navigators. Please feel free to reach out to us, even if it's just for a simple conversation, because 9 times out of 10, the GVRO is the starting point. And after we have a conversation and factor in other factors, it can lead to another type of restraining order. Thank you very much.
Okay. Hi, everyone. Thanks, William and Anna, for that really important information. I know I learned from that as well. I'm going to change gears a little bit to talk about a program designed specifically for teens. So if you have teens in your life, either you parent them, work with them, have some capacity with teens, want to make sure you know about what I think, obviously I'm biased, is the best resource, but really an under-known resource sometimes, which is Teen Line. So this is actually our mission statement, but to back up a little bit and reintroduce myself, I'm Cheryl Eskin, Senior Director of Teen Line. We became a program of D.D. Hirsch about 3 years ago after a lot of years of being our own separate nonprofit. And so this move was great to give us even more support and potentially expand our services. But at core, our mission has remained the same. We have been around since 1980. So again, best kept secret sometimes if you haven't heard about us. And we basically train teens to be listeners for their peers. So we staff a hotline that's open. I'll give you the statistics, I'll give you the information in a minute, but we staff a hotline that's open 6 to 10 p.m. every night. And again, next slide will show that. We're open every night, call, text, and email for any teen anywhere who wants to talk to another teen about what's going on in their lives. The teens who take these calls, texts, and emails are all LA-based teens. They are in person working with adult mental health professionals who support them and debrief, crisis manage, anything you can imagine. And I'll get into that a little more. So each year we train about 60 to 70 LA-based teens to be what we call listeners for their peers. It's a very extensive application, interview, training process because obviously this is intense stuff. We deal with anything on our hotline you can imagine, from a 12-year-old who has a crush and doesn't know what to do to a 17-year-old who might be, in the midst of an attempt. So they are trained to handle all of that, and I'll explain that a little bit more. Another one of our mission statements is also to outreach to the community, like this one, destigmatize and normalize mental health, that we really see that as our role, that it's okay to talk about mental health, it's okay not to be okay. And I think from my purview, our youth are doing better at sometimes than our adults, but we're getting there. So this is, I think this will be sent out after the fact, or feel free to take a screenshot. I'm also happy to send in, we have a Teenline specific website that's teenline.org. Yes, thank you so much. That has all our information. I'm also happy to send out posters, cards, anything that might be helpful if you're in places that teens visit. So again, 6 to 10 every night, Pacific Standard Time for calls, 6 to 9 for texts, and then emails obviously can be sent at any time, but they're answered during our hours. So one of the questions I get is why teen to teen? Why does this matter? Why would I give this resource over 988 or any other resource? And we work with DD Hirsch, we work with 988. We're definitely pro 988 and all the other resources, and use them as referrals ourselves, particularly because we're only open limited hours because teens have to go to school and sleep, etc. But sometimes a teen wants to talk to someone who understands what it's like to be a high schooler in 2025. And sometimes hearing from another teen that what they're struggling with is okay may empower them to have a conversation with an adult in their life, or to reach out for the other help that they need. So these are just some of the reasons. I mean, developmentally, we can all think back to being teens and we thought adults didn't always understand us or get it. I will say, as much as I parent, I have teens of my own, I work with teens, I like to think I know what's playing in language and pop culture. I don't in the same way they do. So they share the same language, similar experiences. We also do hear sometimes that they don't want to bother us. They know we're busy with our own lives and stressed out, and their problem seems inconsequential. Also don't want to get in trouble sometimes. And also, unfortunately, we do hear that not every teen has a trusted adult in their life. So we hopefully help them figure out who that might be, or at least know there's a resource like Teenline that they can talk to about what's going on. So this was just to give you a snippet. People ask what teens are reaching out about. And these are 2024 statistics of, though I think it's probably pretty similar in 2025. So you can see, I mean, we are a crisis line, but we are also in some ways a warm line, in the sense of it doesn't need to, well, I will say in a teen's mind, that 12-year-old again who has a crush on someone, it is a crisis in their mind. Not every person who reaches out to us is at risk. So want to make you aware a teen does not need to be in suicidal crisis to reach out to us. Relationships is the most common reason, which is family, friends, and romantic. Most common reason that teens do reach out to us. And again, that's just something another teen may understand better than an adult. You can also see anxiety and stress that probably matches adults as well. What is interesting is the difference of modalities of how people are reaching out, that we do tend to see a lot more. Suicide comes up more on emails, with whether it's freer to, talk about their feelings, when they're not even having to interact with someone directly, or it feels more removed so they can share it. That's an interesting one. You can also see things like loneliness differ. But in general, these are the top reasons teens are reaching out to us. It definitely, anything else you could imagine, sexual assault, LGBTQ or gender identity struggles, child abuse, they're all in there as well. But these seem to be the top ones. School loneliness and mental health definitely have become, in the last couple of years since the pandemic, we definitely have seen more of those as well. So some other trends, 27% of I would say, I guess, teens, tweens who reach out to us are under 13. So I'm going to go with that being good or bad sense, and nothing is so binary, but maybe a 12-year-old who has a panic attack for the first time and reaches out and finds out that people have panic attacks, there are things you can do about it and get some coping tools, doesn't evolve into the 16-year-old who has never told anyone about the panic attacks and has missed out on the lot of life because of it. So that's my hopeful angle of, younger teens or tweens reaching out. The scary angle is I think we're seeing mental health concerns start younger and younger, and we could all talk for a long time about why that might be, but just something to be aware of if you're working with younger teens and tweens. What we do see also, again, going to the heartbreaking, under 13 are more likely to reach out about suicide and self-injury. So just being aware, because I think there's a lot of thinking, oh, they're 10, they don't know, they can't be suicidal. And just aware, yes, we do hear from 10-year-olds. They don't have the same understanding of death or permanence that older teens might as well, but they are on social media, they are on phones, they are being exposed. So just being aware of that. That is actually it. I hopefully wrapped up relatively quickly. I could talk a lot more about TeenLine, but definitely can go hold it to questions. I encourage you to check out our website. There's a lot of great materials. If you are a social media person, follow us on social media, or encourage teens in your life to follow us. One last thing I didn't add, we are currently in a research study that is funded by AFSP, looking at the impact of this work on the teens who do this work, because I know that's a big concern for a lot of adults. Is this okay? Is this, what does it do to our teens? Anecdotally, we're seeing this as a protective factor, and thus far, our study is revealing that as well. So that's nice to hear, and we can keep you posted on that. So thank you again, appreciate it, and definitely feel free to reach out for materials or ask questions at the end.
All right, thank you, everyone. I love hearing all these presentations. Like Cheryl, I'm taking notes. My name is Cassidy Todd. I am a supervisor at Tarzana Treatment Centers within the Youth Services Department. So I'll be going over today the wealth of services that Tarzana offers to youth, children, and adolescents. We offer two primary categories of services to youth. We have our substance use program, which Tarzana is pretty well known for. We see all levels of care for youth. So that is outpatient, intensive outpatient, at-risk youth, residential services. We do medications for addiction treatment for youth now, and outreach and education through different grant opportunities. And then, of course, our mental health program. So we are a DMH site, and we do individual therapy, family therapy. We have psychiatry services, case management, outreach, and we also now see parents of youth that are enrolled. We have a few different locations that serve youth. Tarzana is a pretty widespread agency. We have 13 different sites, but there are only a couple that serve youth currently. Our biggest one is here in the San Fernando Valley. So in Tarzana, we have our outpatient clinic where we do mental health outpatient services, substance use outpatient, and intensive outpatient services. And all of our MAT services are here as well. We also have services up in Antelope Valley where they do the mental health outpatient and then SUD services at all levels of care. So outpatient, intensive, and residential services. Our residential facility is up in Antelope Valley. We also now have field-based services too. So we are slowly but surely expanding all of our programs to be in the field. So that way we can meet youth where they are at and reduce the barriers to access. So in both programs, in mental health and in SUD, we have various field-based contracts. So we are in a couple of LAUSD schools for mental health currently. We are in the process of launching substance use services in LAUSD as well. For substance use, we are also in Glendale Unified. We are working with Homeboy Industries, a few charter schools in the area. So we're quickly expanding our footprint to be able to serve as many youth, as many families as possible, and just eliminate the need for them to have to come into an office where that might not be as feasible for some. I'll start with our substance use programming. So like I said, we have programming at all levels of care, and all levels of care include the following components. So we do group counseling services for our youth. We do one-on-one individual counseling, and we do care coordination where we can communicate with interdisciplinary teams. We can link families to resources in the community, and a host of other things to make sure that the youth and the system that they exist within are provided for and that their environment is able to support long-term recovery for them. Our treatment planning begins at intake and is done in collaboration with the youth and with their parent or guardian, whoever it is that is involved in their life. And that will continue through the entire treatment episode until discharge. We really make sure that our goals are set for that individual person and not based on what we would assume it should be. So for that reason, we do operate generally from a harm reduction standpoint, depending on what the youth, the family, and their systems need. Safety planning is conducted throughout treatment. So we always do a suicide screener at intake. We do it throughout treatment as well to continue to monitor and assess. And that way, if they are endorsing any suicidality, suicidal ideation, self-harm, or increasing depressive symptoms, we can make sure that they're linked with a mental health provider as well. Since our substance use counselors, they are trained in risk assessment, but they're not mental health therapists. So we want to make sure that they are linked appropriately, which typically we can do internally if they aren't already connected. Youth are able to enroll in our MAT program, which is Medications for Addiction Treatment, if they are actively engaged in one of our substance use programs already. This is a newer initiative that we've launched, and we're really excited to have this on board. We have a few adolescent psychiatrists who are trained in MAT who are able to prescribe different medications to support moving towards safer substance use and sobriety. And then insurances that we can pretty much take anything in our substance use program. Medi-Cal is our primary pot, so a lot of our families and youth that are referred here are Medi-Cal individuals. But we also do work with private insurances. We have a contract with Kaiser, and we can take private pay clients, although that is a big rarity for us to work with that. So going over a little bit of what individual counseling would look like for our substance use clients, a variety of discussion topics. We go over treatment planning and their goals, triggers to use substances, which oftentimes are emotional, can be situational as well. We establish relapse prevention plans, do ongoing safety planning within this realm, and we loop in the family and caregivers in those plans. We identify motivation for sobriety. All of our counselors are trained in motivational interviewing, identify unhealthy associations, practicing coping skills, and looking for addictive thinking patterns that maintain risky substance use. And these are just a sampling of the topics we cover. It's really dependent on what the youth needs, but we stay within that realm of, the behavioral choices around the substance use and how to reduce that. We also do group counseling, like I mentioned. So generally all of our youth that are enrolled will get some aspect of group counseling. These are really designed to support discussion amongst youth with guidance from a trained facilitator so that they can better understand their own problems, the things that they are coming in with, their own suffering, and encourage participation. We've really found that the youth being able to give each other that peer feedback is such an important model for them. They listen to each other a little bit more than they're going to listen to an adult. I think Cheryl is touching on that as well. So these groups are really an opportunity for them to give feedback, to receive peer feedback, to increase that sense of sober support, and just decrease overall isolation that can maintain substance use or contribute to other issues like hopelessness, depression, suicidality. Our group facilitators are trained to recognize and address any risk or suicidalation that arises during group discussion. And all of our programs are equipped where if something does pop up, we have a system to be able to screen and assess either after the group session or to have another counselor step in and kind of pull them to the side so that way we can do a more thorough assessment and just ensure safety overall. All of our groups address healthy coping skills, healthy communication, and just overall reduction of risk factors. That is the overarching theme of the substance use program. This is just, again, sampling of some of the group topics that we work with. We have emotion regulation or anger management, addiction education. We have multifamily groups that are run in both English and Spanish, where parents and the youth can come together to really learn from one another how to create a supportive recovery environment. Relapse prevention, processing groups, healthy relationships, some art expression, and recovery support. But really, our group topics are based around what the youth are coming in with. So these might rotate based on what are some of the presenting concerns and things that we think could be beneficial to the group of youth that we're working with. So who should be referred to the substance use program specifically? This should be a youth presenting to any medical center with severe intoxication that we know then that they are using substances to some degree. Remember that we don't need to only work with folks that are already in the midst of severe addiction. It can be people that maybe they tried something once, or we know that they're experimenting with it. We can work with them on really understanding what their motivation for that is to hopefully reduce ongoing use and reduce the likelihood that they'll engage in riskier substance use. Youth caught with substances at home, at school, in their community centers. This is a big fraction of the referrals we get are youth that are caught with things like vape pens or Xanax or other things like that at school. Youth who we know are actively using substances or they have a history of intoxication. Youth who are at risk for using substances due to environmental risk factors. So this may be if there is a lot of substance use happening in the home, or there are ongoing co-occurring diagnostic issues that places them at increased risk. We can work with those at-risk youth to mitigate risk factors as best we can before a problem escalates. And then youth with co-occurring substance use and mental health difficulties. Many of the youth that are referred to us have dual diagnoses. And since we do have the both programs, we're able to dual enroll them. So that way they get all of their in-house support from a treatment team that's already in communication with one another. Then we have our mental health programming. So this program addresses a variety of mental health concerns and diagnoses. This is primarily focused on individual sessions, so 1 to 2 times a week, depending on level of risk. And then we have a couple of groups that we offer that are supplemental as needed or as appropriate for that individual client. Psychiatry services are also available to youth who are enrolled in our program. So we have a child psychiatrist who can work with them on medication management. And we have case managers that all of our youth and families are assigned to, and they're really able to work with the parents, with the families on any community linkage. They will help the youth or adolescents with resumes or job skills or practicing like communication skills in their session. So it's really a lot of supplemental services to be able to offer to amplify positive outcomes of treatment. Same with our SUD program. Safety planning is conducted throughout all of treatment, and all youth are screened for suicide risk and other safety concerns. And this safety planning and supporting youth in that is a core component of all of our treatment here. We also now have the opportunity to enroll parents of our youth in programming as well. So if a youth is enrolled in any of our services, mental health or substance use or both, their parent is eligible to receive mental health services as well, because we know supporting youth is a lot, and a lot of our youth are coming in distress with a lot of concerns. We want to be able to support the parents in their own sessions so that they can show up and be the support for their kid that they need. So we are able to enroll them in their own individual mental health therapy that focuses on their presenting concerns. And as far as insurance goes, we accept Medi-Cal. Again, that is our primary client that we see. And we have a couple of select private insurance carriers that we can take. We are, I will say, a little bit more limited on being able to accept private insurance mental health patients just because of staffing availability. But we can typically make it work. This is just a picture of what individual or family therapy kind of addresses in our mental health program. So some common presentations, although we do not limit diagnoses that we're able to work with, are depressive symptoms, suicidal ideation, other safety concerns, anxiety, trauma-related concerns, the whole DSM basically. If their primary presenting concern is autism, we will refer out because that's the main one that we can't really work with, or high acuity eating disorder, we'll refer out since we just don't have the staffing to be able to support higher level diagnoses. Group therapy, similar with the SUD, they're aimed to just have additional support for youth and get that peer feedback. We offer things like processing groups and art therapy group primarily, and we do have an LGBTQIA plus group as well. Case management, like I said, we offer case management services in all programs. This is just a sampling of what they can work on, but we really take whole person care very seriously here and want to make sure that the youth and families are connected with everything that is going to be beneficial to them. Who should be referred? Anyone presenting with mental health concerns that can't be addressed in a primary care setting, behavioral concerns, history of trauma, youth with recent psychiatric hospitalizations, you name it, we're really able to work with it. Next slide. And this is a general outline of our referral process. It's important to note that providers can submit referrals through the One Degree platform, so that is what you would primarily utilize. We receive it and then we link it to the appropriate program and then schedule treatment ongoing from there. I believe that's it. Thank you.
Thank you, Cassidy, and thank you, everyone. On behalf of the ACES-LA team, I just want to extend our sincere appreciation. Thank you, Anna and William from the Office of Violence Prevention. Thank you, Cheryl from Didi Hirsch and Teen Line, and thank you, Cassidy from Tarzana Treatment Center for taking the time to speak with us today. We heard from 4 of our partners who really have dedicated their work in helping teens and these teens are facing challenges such as loneliness, stress, grief, and suicide ideation. I just really want to thank each of you for the work that you are doing. It's just really inspiring. And I also want to just remind our audience that each of these organizations they're our partners and they are part of our network. They are here to get referrals for your patient population. So please reach out to them and connect your patients with their organizations. So now I would like to start with our Q&A. Please raise your hand or drop your question in the chat. And we also have some pre-submitted questions that I would like to start with. And first, I want to start with Tarzana. I have a question for Tarzana, for you, Cassidy. Does Tarzana take walk-ins?
Yes and no. So we have to do a screening process for the insurances. So we will accept walk-ins in the sense that we're able to get all of their information and start the screening process. And then we can probably schedule them for an intake. We just can't guarantee that there's a clinician available in that moment to do an intake, but we can begin that process on a walk-in basis.
Okay, great. And I have a second question that will kind of just like go straight into that. It says, what demographic items do we need to bring at that initial intake for the patient? Like what kind of documentation?
Yeah, so typically it is their insurance card, so Medi-Cal card, private insurance, whatever that's going to be, their state ID, so whatever format they have that in. If it's a youth, we require it from the parents of the person who's over 18. And then that is pretty much it. But our navigators are really great at if we're scheduling something, they will send you a detailed email and text with everything that you need to have ready. But most of the stuff will be done in office.
Okay, great. Thank you so much. Okay, so also, this could be for any of the panelists. Do you have any wait lists at this point? Are there any wait lists for any of the services that are offered? I mean, maybe not for you, Cheryl, for Teen Line, but any of the services that you're offering at OVP or Tarzana Treatment Centers, do you have any wait lists?
No.
Yeah, similar to Tarzana, the only time that we might have a wait list is in our residential program if we don't have bed availability. That would be the only thing. But currently, we do have availability, though.
Okay, that's fantastic.
Really, if I can also add, I just emailed you all the flyers for the support groups in service planning area 1 and 2. Okay. They are actively recruiting for their cohorts. They just started cohort 1 in the month of October. They are struggling a little bit with youth attending. Parents want them in those support groups. These are peer support groups for youth that have that are experiencing any level of grief due to someone in their community that have died by suicide. And SPA 1 and 2 continue to be our highly impacted communities when it comes to rates of attempts and actual death. So thank you so much, Denise. I see that Denise already dropped those there. And yeah, they have availability.
Okay, we have Denise dropped it in the chat. So if anyone, we'll distribute that out and we'll try and get those spaces filled. If anyone knows of any teens that need to maybe attend that would be helpful. So please look into that. Wonderful. Okay. We have a question from Sandra in South Valley. Does anyone have any support groups in the AV?
So we have groups in our programming up in AV. Currently, I believe that they're limited to folks that are already enrolled in services of some kind, and we have groups for SUD or mental health side of things. We are looking for ongoing like grants, which would provide additional, funding for support groups in the community for non-enrolled youth.
Okay. And Anna, yours are in SPA 1, correct?
So that would be the Antelope Valley community. And although the groups are geared to support youth going through grief, we are working with You Are Enough, an organization that is well rooted in the Antelope Valley, and they can support with other types of support groups if needed. So I encourage you to reach out either to me or the contact on that flyer that was just dropped in the chat.
Okay, and so those could be more like mental health services, mental health support for the You Are Enough campaign, correct?
You Are Enough is actually a nonprofit organization in the Antelope Valley, and they are very connected with other types of support groups. And so I was mentioning that if the grief support group that we are funding in this particular effort is not what the youth is needing, I would reach out to the AV, the Antelope Valley Partnership for Health. They are our main contractor, and they have subcontracted with You Are Enough to actually facilitate and run groups.
And I believe our wonderful Denise just dropped another link in the chat. So please, audience members, please go to the chat. There's all these wonderful resources and links in there to follow up from our speakers, our presentations. We have another, I know we're running close on time and I have a couple announcements, but do any of you provide services for the undocumented individuals? I see Cassidy shaking her head.
Yes, we do.
Okay.
Yeah, and Teen Line doesn't. Yeah, Teen Line is open to anyone, regardless of any status.
Okay.
They just have to be a teen.
Okay.
And I also want to mention that the support groups that we're running are not tied to any kind of, there's no charge of any sort. So a youth does not need to be on Medi-Cal, for example, or private insurance. It's a universal type service. And so anyone can join. Okay,
wonderful, wonderful. I want to talk a little bit about our YSPP collection so that our audience knows about this. Our organizations that we've talked about are all within this YSPP collection. The ACES LA team is willing to train any of the providers here on this collection. So we have 84 plus resources of youth suicide prevention, grief support services in a variety of hotlines, programs, support groups. And so this is all on the One Degree platform. This is a new collection that we've put together with partnership with many CBOs and the Office of Violence Prevention. So please contact, I'll put my email in the chat. If you would like to be trained on this collection via One Degree, please contact us and we will train you how to find this collection. I think Denise dropped it in the chat, but also how to utilize this to make referrals regarding youth suicide prevention. So please, this is a new collection for you to access resources in this area. And we at ACES LA encourage you to use this collection. We also have a webinar at one of our partners. So Bright Life Kids is holding a webinar. It's called It's Okay Not to Be Okay on December 11th. Understanding that the holiday season is difficult for many, and it does stir up big feelings about loneliness, worry, grief, and stress. So Please, if you know anyone, please pass this along to anyone, or if you yourself are feeling a little bit of anxiety or loneliness or anything about the upcoming holidays, Bright Life Kids, who's a wonderful partner of ours, is holding this webinar. And it's registration. There's a registration link on their website for this. We have concluded our 2025 Lunch and Learn series. And we are so excited and proud of all of our Lunch and Learns, especially this one. And thank you so much for our presenters for helping us end our year. Please, we'll see you in 2026 in February. We're going to take 2 months of a break, December and January. But if you'd like to revisit all of our wonderful Lunch and Learns, they are on our website, all recorded. You can see any of our websites from 2025, and we look forward to putting more and more content together, some great presenters for 2026. And just thank you for being part of our audience, and have a wonderful new year. So thank you for joining us. Bye-bye.